So a really great thing for students to do to integrate themselves more into the team is to introduce themselves to everyone in the team, all the doctors and nurses. And actually, every time you see a new patient, introduce yourself to the patient, say good morning or good afternoon, and it actually makes you part of the team because the patient will talk to you, the doctors will talk to you, and that's really, really helpful for the students. So when you arrive onto the ward, go and find the F1 or the F2. They'll have a full list of jobs that need to be done, and they'll know the patients and know which patients would be good for you to go and see. This means that you'll be able to practice skills such as cannulation and taking bloods, and you can also chat to some appropriate patients or any interested patients. So definitely go and find the foundation doctors. So a common thing that students will say is that there's actually nothing to do on the wards, but this really is just never the case. You can always go read some notes, read some drug charts. There's always a list of jobs that need to be done. Patients are quite bored, they have a lot of questions, and students are actually a really valuable source of knowledge for them. So if you go in, take some histories, do an examination on them, you can answer some of their questions, and they'll be happy to do that because they won't really have been talking to anyone. So that'll be helpful for both the student and the patients. So there might be some situations where you're given a job that you think actually is a little bit beyond you. So please don't feel that you can't tell the nurse or the doctor who's given that job that it's too beyond you and you've never done it before. So a really good way is maybe suggesting if you watch them do it first and then you could do it straight after. Watch one, do one. It's a really good way of learning and it would make you feel less nervous. So as students, we all have these different coloured badges. They are great for the doctors because they can all know what year you're in and therefore what things to target towards you. Also, if you're struggling a little bit as a student, just refer to the Student Expectations Guide. This will help you really concentrate on what you're expected to get out of your placement and things that you're supposed to be doing at your level. And also a really great way for the staff to know what they should be targeting for your certain year group would be to ask them to read the Student Expectations Guide. This means that you'll get the most from your placement, you'll be able to achieve all of your outcomes, and you won't feel a bit out of your depth either. What would be a great thing is if you ask for feedback, if you ask them to come and observe you and then go into a quiet room where you can discuss the things that need to be made better and the things that you've done well. If you do it by the bedside, sometimes the doctor might not want to tell you things that you've done wrong in case of offending the patient. So it's always best to just ask to pop into a quiet room and just go through what you've just done. So in summary, some great tips for students to get the most out of placement is to just introduce yourself to the doctors, introduce yourself to the patients. It gets you more involved in the team, gives you a little bit more confidence. Secondly, it would be really good if you think that there's nothing going on the wards, this isn't the case. So always go and talk to patients, take some histories, do some examinations, look through their drug chart. This always means that the patients are usually quite bored, they want to chat to you, and you're bettering your own learning. If you feel like you've been given a job that's beyond you, please tell whoever's given it to you that you're not comfortable with it. There'll be an opportunity to watch one and then do one so you can learn a skill, but you should always let them know if you feel that it's a bit beyond you. We all wear badges that have our year on, and every year has different expectations. So if you refer to the Student Expectations Guide, this can help you figure out what you should be achieving from the placement. And you could also ask the doctor to read through that as well, and they can help target what you're supposed to be getting out of the placement as well so that you have a successful placement.